Time now, 5:36. Turning now to your health headlines. February, if you didn't know, is American Heart Health Month. The CDC says heart disease, though, can be linked to some cancers, and some treatments for both can damage your heart. Well, now medical professionals are studying the cardio-oncology field even more.
Lakita Johnson spoke with the only board-certified oncologist in Memphis about the impacts. Lakita, good morning.
Yeah, good morning, ladies. I also spoke with the doctor's patient. Her name is Jamie Blackwell, who was diagnosed with Hodgkin's lymphoma. It's a type of cancer that affects our immune system. Well, years after surviving it, Blackwell started having heart issues because of the radiation treatments she received. But new research is helping her fight it. Take a look.
I had lost everything, my health and my job and my house and my retirement funds.
Jamie Blackwell is a living testimony. Her journey started in 1974 after learning she was diagnosed with Hodgkin's lymphoma while in college to pursue her dreams of becoming a pediatric emergency room physician.
This was one of the first cancers that we're starting to be able to cure. Not just give you some time, but actually cure it.
Following her radiation treatments, Blackwell says she still found herself sick a lot, experiencing rapid heartbeat palpitations and shortness of breath. So after visiting the lung doctor for a test, she first learned it was her heart that was now the issue.
What they didn't know back then was that they didn't know how much radiation to do. So they gave big doses. We've learned now there's a lot of us long-term survivors.
Blackwell had open heart surgery bypass and thought that fixed the heart problem. But it was only the beginning of a lifelong battle, nearly 20 years after her radiation treatments.
It was really scary. Nothing made sense. We talked to my doctors and we knew about the radiation. We knew that did the scarring for the surgery, but why was this so bad?
Even after many visits to cardiologists, there was no clear answer until she learned about the Hodgkin's lymphoma support group for long-term survivors on Facebook, where there were others with similar stories. She found out about Dr. Isaac Ray, who's the only board-certified cardio-oncologist in the Memphis area at Methodist Le Bonheur Healthcare. Ray was able to detect that Blackwell's radiation treatments led to heart disease, an answer she'd been looking for.
He said, "You are the type of person that I studied for."
This came as a sigh of relief that he could also help treat her condition, thanks to the new guidelines from the European Society of Cardiology, which establishes what cardio-oncology should be and should look like.
I think the most important thing is that there have been so many conflicting recommendations, even from all sides, from the oncology side, from the cardiology side. This finally puts it together, saying here's really what you should be doing.
Ray says heart disease after cancer therapy is slightly more common in women, but also mostly depends on the therapy received and the risk factors they have at the time. He says no matter the condition of your heart, here's what you can do.
You should still exercise. They say 150 minutes a week. For cancer patients, that can be very difficult. I will take whatever I can get. Watching your diet the best that you can. Now, that's trickier for cancer patients because some are struggling to eat and some are not. So obviously trying everything in proper moderation and dosage. But mostly trying to take care of the other issues that already exist, whether it be the high blood pressure, whether it be cholesterol, diabetes.
Yeah, also their biggest message here is if you feel something isn't right, go ahead and get it checked out. Ladies.